Hello, in this video I'll be talking about cranial nerve 3 damage. The cranial nerve 3 has so many fibers. It has the motor fibers, the parasympathetic fibers, the inner fibers, the outer fibers. Some are affected in diabetes, some are affected and gets compressed first, and it's all so hard to remember. But fear not, my friend, for I have a mnemonic. So let's get started. The cranial nerve 3 has the inner fibers, which are known as the central fibers. They are the motor fibers. Now I call them the middle fibers because M for middle and M for motor. It's just so easy to remember that way. And they supply the extraocular muscles. So M for muscles, and that makes life so simple. Similarly, the parasympathetic fibers are present in the periphery, P for parasympathetic, P for periphery of the nerve, and they supply, well, you guessed it right, P for pupils. So, and I've also drawn the parasympathetic fibers like a circle because they remind me of the pupils. So, which would get affected in diabetes or any vascular disease. Now, if you're logically thinking, the blood supply to the nerve will be from somewhere outside of the nerve, and then the nutrients and the glucose and the oxygen have to diffuse through the nerve fibers to get into the middle. So now if there's something which is compromised, then the nutrients will not be able to diffuse to the middle, so the motor fibers will be affected first in conditions like diabetes mellitus. The way I remember this is, again, diabetes mellitus has an M and M for motor fibers, which are in the middle, which supply the extraocular muscles. What would affect the parasympathetic fibers? Well, basically, if there's any mass or anything that is compressing the cranial nerve from outside, it would affect the parasympathetic fibers first. The things that I can think of right now is posterior communicating artery aneurysm, and it starts with a P again, and maybe like uncal herniation, anything that would increase the intracranial pressure, or any mass or tumor can affect the parasympathetic fibers first before they devour on the motor fibers. No, I'm just kidding. So for a quick revision, M for motor, which are present in the middle, which supply the extraocular muscles and will get affected first in diabetes mellitus and other vascular diseases. P for parasympathetic, P for peripheral fibers that supply the pupils and will be affected by posterior communicating artery aneurysm or any mass. And that is all. I hope that was helpful. I'll upload the notes on the blog as usual, and you can go check them out at medicalawesome.com. Stay awesome.